Today, I'm going to say a little bit about tetanus and tetanus vaccination in response to a question I got. So, tetanus is caused by a bacteria called Clostridium tetani, and it's ubiquitous. It's in the soil, it's in the environment. And the thing about this bacteria is that it produces a toxin called tetanospasmin, and that's what causes the characteristic symptoms of tetanus, which includes kind of muscle spasm. And that muscle spasm is what causes lockjaw, which is one of the more famous manifestations of tetanus. So, what happens is you've got a wound that somehow tetanus bacteria gets into and it produces that toxin, and then you get the symptoms of tetanus. And they can be quite severe, leading to difficulties breathing, leading to your whole body basically spasming in this very demonic looking posture called opsothonis. And it can kill people. So, tetanus immune globulin, tetanus immunizations were one of the first types of therapeutics we had against an infectious disease. And this kind of comes from the golden age of microbiology and the golden age of vaccinology, where if somebody had a tetanus prone wound, you could give them antibodies that were formed in another animal, like a horse, for example, and that would bind up the toxin and it would diminish the symptoms. We're now at a point where we give vaccines to people that are based on that toxin. They're toxoid vaccines. And standard teaching is you get a tetanus shot every decade, every 10 years. There is some data that probably once you've gotten your primary immunization series that you don't necessarily need to get these things every 10 years. That hasn't changed in the guidance yet. There is some data that maybe they last 30 years or longer. And remember, tetanus shots are a series that you get as a child, and then every 10 years you get a boosting. But we haven't changed the recommendations. And part of that might be because there is other things that are in the tetanus vaccine. So tetanus is grouped with pertussis or whooping cough vaccine as well as diphtheria vaccine, and we do have a problem with whooping cough vaccines, vaccination levels as well as whooping cough cases that are occurring at high levels. So right now, that's the way that people get immunized against whooping cough is to get this tetanus shot. So I don't see that unbundling at this point right now. But tetanus is something that is quite rare, but is something that is ubiquitous in the environment.